14 bizarre symptoms of vitamin D deficiency. You need to know. Have you ever wondered why so many people suffer from seemingly unconnected symptoms such as fatigue, mood swings, or even insomnia without ever finding a clear cause? What if the answer lay in something as basic as vitamin D, a nutrient your body desperately needs to function properly? Vitamin D deficiency is more common than we think, but the signs often go unnoticed, hidden behind other health problems. What are the dangers of ignoring these symptoms, and how can you identify if you are lacking this vital vitamin? Get ready, because in this video, we're going to explore the most unusual and surprising symptoms of vitamin D deficiency. With science-based information and clear explanations, we will help you understand how to identify and treat this problem before it affects your life further. Let's get started. What causes vitamin D deficiency? Vitamin D deficiency may seem simple, but its origin is more complex than you might imagine. One of the main causes is insufficient exposure to the sun. Sunlight is essential for the skin to produce vitamin D, but with frequent use of sunscreens, long hours indoors, and lifestyle changes, many people are getting much less light than necessary. Furthermore, geographic factors also play an important role. People who live in areas with little sunlight or in regions with harsh winters are more likely to suffer from this deficiency. Another crucial factor is nutrition. Although some foods, such as fatty fish and eggs, contain vitamin D, the modern diet often lacks adequate amounts to meet the body's needs. Finally, medical and genetic conditions can make it difficult for the body to absorb and utilize vitamin D. Diseases such as obesity, kidney and intestinal problems, or even genetic mutations can significantly reduce the body's ability to process this vitamin. Understanding these causes is the first step to preventing or correcting vitamin D deficiency. But is it possible to reverse the damage caused by this deficiency? Is it possible to reverse the symptoms caused by vitamin D deficiency? The good news is that yes, most symptoms caused by vitamin D deficiency can be reversed, especially when diagnosed and treated early. The first step is to correct the levels of this vitamin in the body, which can be done through three main strategies. Sun exposure is one of the most natural and effective ways to increase vitamin D levels. Around 15 to 20 minutes of sun exposure daily, without sunscreen, at safe times, such as in the morning or late afternoon, may be sufficient for many people. Additionally, supplementing vitamin D is an affordable and widely used option. Doses vary depending on the level of deficiency, and it is important to perform blood tests and follow the guidance of a healthcare professional to determine the ideal amount. Diet changes also play a key role. Including foods rich in vitamin D, such as salmon, sardines, egg yolks, and fortified foods, can help restore vitamin D levels in the body. However, not all symptoms disappear immediately. Some effects, such as muscle weakness or bone problems, may take weeks or months to improve, even with proper treatment. Therefore, it is essential to be consistent and patient. When the deficiency is corrected, the benefits are clear: more energy, better mood, stronger bones, and even a more robust immune system. Now, how do you know if you really need supplementation or lifestyle changes? This is where the importance of specific tests to measure vitamin D levels comes into play. What tests should I take to find out if I have vitamin D deficiency? Identifying vitamin D deficiency starts with a simple but extremely revealing blood test. The most common test is for 25-hydroxyvitamin D, known as 25-OHD. This test measures the inactive form of vitamin D in the blood, which reflects the reserves available in the body. Levels considered ideal may vary, but are generally between 30 and 50 nanograms per milliliter. If the result is less than 20, this indicates a clear deficiency. Furthermore, it is important to know that other factors can influence the levels detected in the blood. For example, normal levels of vitamin D in the blood do not always indicate that it is being properly used by cells. For this reason, in more complex cases, the doctor may order additional tests to assess how vitamin D is being metabolized in the body. Another important point is that people with specific conditions, such as obesity, kidney or intestinal diseases, may need more frequent monitoring. Finally, it is essential to carry out these exams under the guidance of a healthcare professional. This ensures that results are interpreted correctly and that necessary interventions are carried out safely. Discovering your disability is the first step to regaining your health. Now that we understand how to diagnose, it's time to explore the more unusual signs that you may be suffering from this deficiency. Symptoms of vitamin D deficiency you never imagined. 1. Excessive sweat on the head, the first warning that nobody realizes. One of the most unusual and often overlooked signs of vitamin D deficiency is excessive head sweating. Although this is mostly seen in babies, adults can also experience the same symptom, especially in situations where there are no obvious reasons for the sweating. This phenomenon is related to the autonomic nervous system, which regulates involuntary functions such as sweating. When there is a vitamin D deficiency, the balance of the nervous system is affected, causing increased sweating in the head region. If you notice that your forehead or scalp is often damp, even in mild temperatures, it may be an indication that your vitamin D levels are below ideal. Identifying this symptom can be the first step in correcting a deficiency that, if ignored, can develop into more serious problems. 2. Night sweating. Why do you wake up with your pillow soaked? If you wake up in the middle of the night with your pillow damp with sweat, even when the room is cool, your vitamin D deficiency could be to blame. This symptom, apparently unrelated to other problems, may be a reflection of an unbalanced immune system. Vitamin D helps regulate the body's immune response, preventing it from becoming overactive or underactive. When levels are low, the body can interpret this as a warning sign, increasing body temperature to combat a supposed threat, which leads to night sweats. Although often attributed to stress or poor sleep quality, this symptom may disappear with correction of vitamin D levels. 3. Mood swings. The silent impact of a lack of this vitamin. Have you ever noticed sudden changes in mood, going from happy to irritated in a matter of minutes? This emotional roller coaster may be caused by low vitamin D levels. This vitamin plays a key role in regulating neurotransmitters in the brain, such as serotonin, which is responsible for feelings of happiness and well-being. When vitamin D is lacking, there is a dysregulation of these neurotransmitters, leading to sudden and intense emotional changes. If you or someone close to you has these symptoms, correcting the deficiency can be a simple and effective way to stabilize emotions. 4. Procrastination, the invisible reason for your lack of motivation. Do you feel like no matter how hard you try, you just can't start or complete tasks? Procrastination may have an unexpected link to vitamin D deficiency. This vitamin is directly related to the production of dopamine, a neurotransmitter crucial for motivation and the sense of reward. When vitamin D levels are low, dopamine does not work effectively, resulting in a lack of motivation and feelings of apathy. Furthermore, the lack of energy caused by vitamin D deficiency can intensify this situation, making even the simplest tasks a challenge. If you're constantly putting off important appointments or tasks, it's worth considering the possibility that your health is crying out for attention. 5. Panic attacks, an unexpected call that could change your life. Panic attacks are intense episodes of anxiety and fear that can come on without warning. Although often attributed to emotional factors, vitamin D deficiency can also be a contributing factor. Vitamin D influences the balance of neurotransmitters such as serotonin, as well as playing an important role in the functioning of the amygdala, an area of the brain that regulates fear and anxiety. When vitamin D levels are low, this regulation is impaired, increasing the predisposition to panic attacks. People who suffer from these episodes may benefit from careful assessment of their vitamin D levels, as appropriate treatment can help reduce the frequency and intensity of attacks. 6. Pain in the pelvis, lumbar and thighs. What is your body trying to say? Persistent pain in the pelvic, lower back, or thigh region can be a clear sign that something is wrong with your bone health. Vitamin D is essential for the absorption of calcium, which strengthens bones. When this vitamin is lacking, bones begin to lose density, resulting in a condition known as osteomalacia, characterized by deep, diffuse pain. These pains are usually not sharp, but rather a constant discomfort, indicating that the bone structure is weakening from within. If left untreated, this deficiency can lead to more serious problems such as fractures or bone deformities. Correcting your vitamin D levels can not only alleviate pain but also restore the health of your bones. 7. Loss of muscle strength. Why do you feel so weak? The feeling of muscle weakness can be more than just tired. Vitamin D plays a crucial role in muscle contraction as it regulates the absorption of calcium, essential for muscle function. When vitamin D levels are low, muscles lose strength and efficiency, especially in the areas we use most, such as legs and shoulders. Furthermore, a deficiency in this vitamin can affect muscle regeneration capacity, making recovery from exercise or injury slower. If you notice increasing difficulty performing previously simple activities, such as climbing stairs or carrying light objects, it's time to investigate your health and consider vitamin D deficiency as a possible cause. 8. Rigidity in joints, how it can affect your quality of life. Stiffness in joints, especially in the knees and fingers, can be a sign of vitamin D deficiency that goes unnoticed. This vitamin is essential for the maintenance of collagen and cartilage, components that guarantee joint flexibility and mobility. When vitamin D levels are low, these structures begin to deteriorate, leading to inflammation and a feeling of stiffness. Furthermore, deficiency can aggravate pre-existing conditions, such as osteoarthritis, making movement even more limited and painful. Practicing stretching exercises and correcting vitamin D levels are simple measures that can alleviate stiffness and improve your quality of life. 9. Chronic fatigue, the villain hiding behind your constant tiredness. Do you feel like you're always tired, even after a good night's sleep? Chronic fatigue is one of the most common symptoms of vitamin D deficiency, directly affecting mitochondria, which are the cell's energy plants. Without sufficient vitamin D, these structures cannot produce energy efficiently, resulting in constant tiredness and difficulty performing daily activities. Furthermore, low levels of vitamin D can reactivate latent viruses, such as Epstein-Barr, which further intensify the feeling of fatigue. Identifying and correcting this deficiency can restore your energy and vitality, significantly improving your quality of life. 10. Mental slowness, the blockage that nobody attributes to vitamin D. Do you have difficulty concentrating or make decisions more slowly than usual? Vitamin D deficiency can directly affect brain function, especially in areas related to memory, focus, and reasoning. This vitamin plays a vital role in communication between neurons and in maintaining the health of the prefrontal cortex, responsible for planning and decision-making. When levels are low, the brain operates as if it is in an energy-saving mode, resulting in mental sluggishness and cognitive difficulties. Correcting your vitamin D levels can improve not only your mental clarity, but also your ability to face everyday challenges more efficiently. 11. Dissatisfaction when eating. Why do you never feel completely satiated? Have you ever finished a full meal and still felt hungry? This may be related to vitamin D deficiency, which directly influences the action of two crucial hormones, leptin and insulin. Leptin is responsible for sending the signal of satiety to the brain after a meal, but without adequate levels of vitamin D, this signal can be compromised. Additionally, insulin, which helps transport nutrients to cells, also depends on vitamin D to function properly. Without it, your body can enter a state of false hunger, causing you to eat more than necessary. Adjusting vitamin D levels not only helps with satiety, but can also be a valuable tool in weight control and promoting a balanced diet. 12. Unexplainable insomnia, a clear sign that may be going unnoticed. If you have trouble sleeping or wake up frequently during the night, vitamin D deficiency could be one of the causes. This vitamin plays a fundamental role in the production of melatonin, the hormone responsible for regulating the sleep cycle. When vitamin D levels are low, melatonin production can be affected, resulting in insomnia or fragmented sleep. Additionally, vitamin D helps calm the nervous system, preparing the body for restful sleep. Correcting this deficiency can significantly improve the quality of your sleep, restoring the feeling of rest and renewal when you wake up. 13. Hair loss, what the health of your hair reveals about your vitamin D. Hair loss can be distressing and is often attributed to factors such as stress or genetics. However, vitamin D deficiency can also play a significant role in this process. This vitamin is essential for hair follicles, which depend on it to grow and renew themselves. When levels are low, follicles can weaken, resulting in thinner strands and excessive hair loss. Additionally, vitamin D deficiency can worsen conditions such as alopecia areata, an autoimmune disease that causes hair loss in specific areas of the scalp. If you've noticed a reduction in hair density or more severe hair loss, consider checking your vitamin D levels. Correcting this deficiency can help strengthen hair strands and promote healthier growth. 14. Frequent infections. The immune system may be screaming for help. Have you been getting sick more often than usual? Colds, flu, and recurring infections can be signs that the immune system is weakened, often due to a lack of vitamin D. This vitamin is essential for activating immune system cells, such as T lymphocytes, which defend the body against infections. Without sufficient vitamin D, these cells cannot respond effectively to threats, leaving the body more vulnerable. Furthermore, deficiency of this vitamin has been associated with greater susceptibility to autoimmune diseases and chronic inflammation. Ensuring adequate vitamin D levels not only strengthens the body's defenses, but also helps prevent long-term complications. Your health is a reflection of the choices you make every day. Understanding the importance of vitamin D and recognizing the signs of its deficiency is a crucial step towards transforming your quality of life. If you identify with any of the symptoms described, do not hesitate to seek medical advice and carry out the necessary tests. Remember, small adjustments to your routine can bring big benefits. Take care of yourself, listen to your body, and value your health as your most precious asset.